Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guests are Mary Daigneault, a psychotherapist, and Robin Cohn, a survivor of traumatic brain injury. Welcome to the show, ladies.
Thank you.
Mary, why don't we start with you? Can you explain what you do and what kind of practice you have?
Sure. I'm a clinical social worker. I have a private practice in Albany. And I've had the opportunity to work with people with who have sustained brain injury for a long time now, for a few decades. And in my practice, I do see a number of people who have traumatic brain injury.
Okay. And Robin, what happened to you, how many years, 16 years ago?
Approximately 16 years ago.
How did you get your traumatic brain injury?
In a car accident. I was in a car accident, rear-ended while stopped. And, just knocked unconscious, and when I came to and found myself in the hospital, I was told that I had sustained a pretty significant concussion, that I would be fine. But things weren't fine. And it took a while to finally get diagnosed and proper treatment. And then I was re-injured in 99, unfortunately, so a lot of the progress I had made from 95 to 99 was undone.
Oh boy. Okay. So why don't we begin by, Mary, can you define a traumatic brain injury or just brain injury in general?
Mm-hmm. Well, a brain injury is basically anything that happens to the brain to cause trauma and to cause damage and that translates into altered functioning. Mm-hmm. And that can include accidents, car accidents, blow to the head. It can include stroke. It can include exposure to toxic chemicals, blast injuries, loud noises, okay. Any number of things that can happen that will cause insult or injury to the brain.
Okay. And you have seen many examples of problems and challenges faced by patients that have experienced traumatic brain injury. Can you describe some of them?
Yes, life can change in so many ways. There are changes that occur cognitively, meaning one's thinking skills or thinking abilities are altered. People find that they have a difficult time with concentration and focus and attention. They find that they have difficulty with memory. They find that they experience personality changes. Family members often observe that, even if the individual who's injured doesn't recognize it themselves, his or herself. Mm-hmm. They experience oftentimes fatigue. That becomes a major issue often for people, that their stamina and endurance is greatly reduced and they deal with high levels of fatigue in daily life. People sometimes experience hypersensitivity to sound, to visually taking in activity or bright lights. That makes it difficult to be out in public, to go shopping at the mall. Can be tough even just being at family events where there are a number of people present and talking. Mm-hmm. It's easy to get overwhelmed by the noise and the activity, as well as light. Those are some of the problems, not all of them. Life can change in so many ways.
And I'm imagining that if I was faced with all of those obstacles, that my level of anxiety and my level of depression would be a lot higher, wouldn't it?
You bet, Peggy. Yeah, your life changes so dramatically. Oftentimes in the beginning, people don't even realize they're sort of in a fog. The injury itself creates a sort of fog, and they don't really fully understand what's going on. That creates a huge amount of anxiety because your functioning has changed. You sense it or feel it in some way, though you may not understand it. And anxiety, yes, is a common result of that. I've heard from so many people over the years that before they get diagnosed, and many people don't get diagnosed right away, they wonder, am I going crazy? That's a really common response. They wonder, what's wrong with me? I know something is terribly wrong. And sometimes even people will go to the doctor and talk about their symptoms, and oftentimes it goes undiagnosed.
That's one of the things I was going to ask was, let's say somebody has a minor stroke, and somehow they go through the rest of their life not even knowing that they ever had a minor stroke. But they have the manifestation of symptoms.
Yes, that can happen. Somebody can be in a car accident that's really not a big car accident, but let's say there's some sort of physical injury. They hurt themselves physically in some way. When they go to the hospital, the physical injury is usually what's dealt with first, out of necessity, if there's bleeding or some sort of situation that it poses a risk to health or well-being, to safety. And the fact that they've sustained a concussion, which is a form of brain injury, goes unrecognized. So they go home and they don't notice right away, but maybe a couple days, they've got a headache, they're just not feeling like themselves. A little bit at a time, they recognize that they're changing, that something's different. They go to the doctor, they complain about it, but oftentimes it's just not caught for a time.
And that's what happened to you, right, Robin?
Yeah, I was told, go home, you're going to get better, move on with your life. It's all going to be okay. And I believe that to be true because I was a very active, organized, efficient person. So I wanted that to be true. So I just forged ahead. But I couldn't function. I couldn't read, I couldn't write, I couldn't walk without holding on to walls. I just felt like I had lost myself, and I didn't know why, and it just wasn't getting better.
Now, how long were you out of work as a dental hygienist before you tried to go back to work, and what happened the day you tried to go back to work?
Well, they wanted me to just stay out until, all the cuts and bruises healed, until I had massive headaches. They thought maybe they would subside if I just rested. So I did that for a few days, and I was anxious to get back to my work, so I went back within a week and a half to 2 weeks. But the place that I had worked at for 6 years, I couldn't find my way there the first day back. I had lost sense of direction. I had no idea how to get there. And with some help, I finally made it, but I had forgotten how to do my work. I had forgotten how to use my dental instruments. I couldn't use the computer. All of these things that were just so routine to me had just become such a challenge. And, I had a lot of right-sided weakness, like they call it right-side paresthesia. So I couldn't really feel the instruments in my hand. I became a risk to my patients. Plus the fact that my patients were backing up in the waiting room. I couldn't stay on task. So there were all these signs. I knew something was wrong. The level of fatigue was so overwhelming that and it's not your normal fatigue. It's really difficult, deep down fatigue that you just need to stop what you're doing. So eventually, my boss was recognizing that there were issues, and he asked me to just go home and take care of myself, and get better. And I was eventually replaced because I just wasn't getting better.
Now, what about your memory deficits? How did that manifest?
Familiar routines just were really hard to remember. I couldn't. I just couldn't remember things that you don't even think about. You just do.
So you would read a chapter of a book, and then have to reread it?
I would reread it because when I would close it, it would just all disappear, and I would have to start over. And especially if there were a few characters in the story, I was just totally lost. I forgot sequencing. I couldn't sequence events in my life, from taking a shower in the morning to putting my clothes on. I couldn't figure out the order that things were done. And, I'd be stuck. I'd be stuck in the closet trying to make sense of my clothing and figure out how things went on.
And you would have to make sure, once you got dressed, that everything was put on correctly.
Yeah, or then I'd have severe anxiety attacks or panic attacks if I were out in public, wondering if I had them on in the right order. And It's frightening. It's frightening because you know something is terribly wrong and everybody is telling you you're fine, because outwardly it looked fine, but it still to this day takes so much work to get organized, to know where I have to be. I write everything down. So I'm 16 years post, but I've had a lot of therapy. I've had a lot of, tools in how to organize myself.
And when you are exposed to, a lot of things all at once, whether it's you're driving in a rainstorm, you're sitting at a wedding reception with loud music, how does that affect you?
Well, that's interesting you should ask, because I was at a wedding last weekend and I'm about to go to another one today, and I am just absolutely exhausted, and it's just hard to get myself motivated to do anything. And when I get to those situations, I become so overloaded by all of this stimulation coming at me. People moving, talking, music, lights, conversation. It becomes debilitating. So much so that I feel like my body just shuts down and I can't take in another, almost like a wet sponge.
So how are you able to drive when it's raining and the windshield wipers are going crazy and the wind is blowing?
It can be a challenge. There's many times I just pull over. When I feel that fatigue hitting me or being overloaded, I'll get off the road. I know enough to stop what I'm doing and get myself off the road. I've pulled off the road many times and just kind of ground myself, wait till the rain subsides, or just get myself kind of calmed down before I can proceed. But it's learning coping strategies. It's learning how to get through your day without being so overloaded. And that may mean that your world shrinks down pretty small, which mine has over the years.
Well, so if you're lucky enough to be able to not work and be okay financially, then it's easier, isn't it?
Well, it's easier, but it's still stressful, because I did have a profession and I was part of the income producer in the family. I was the other half, and so it does put a significant crimp on your life. So it's not that, oh gee, I get to stay home and it's so much fun. It's not. It's not, because a lot of things get affected. I do run a women's support group, and I hear it on a constant basis, women coming to me saying, I was a lawyer, I was a doctor, I was successful and productive, and now I can't work. So that in itself is a stressor, just trying to do as much as you can to help out.
Anything you want to add to what she's been saying?
You mentioned depression earlier. And as life changes so dramatically and people lose their functioning, which can result in a loss of their job, that's such a huge blow to self-concept. Most of us define ourselves to some extent through our employment, to a large extent often. So to lose your job and to find that you can't do what you could do in a day, you can't clean your house the way you used to clean your house. You can't go to the grocery store. Even with a list, it's overwhelming, and people will often say, I leave without everything I needed, or I got so overwhelmed I couldn't even shop. So as Robin is saying, life gets smaller and smaller and smaller, and depression is, of course, obviously something that people will often fall into. You lose so much. Your sense of self then is so completely altered that oftentimes people will experience depression for a period. So there's the confusion and the anxiety, and there's depression. All of this ideally is going to be addressed through some form of treatment.
So that leads me to the next question. How is one treated that suffers from these illnesses?
In the best case scenario, somebody goes to their doctor, and if it wasn't identified immediately, like at the scene of an accident when you go to the ER, at some point, hopefully not too far down the road, your doctor recognizes that you have a traumatic brain injury. The next step is to be referred for a neuropsychological evaluation. And this is a testing process that you go through. It's fairly lengthy, often done over the course of a few sessions because it takes several hours to complete. and people have too much fatigue to do that, in large.
All at once.
Yeah, they have to break it down. So you go for the neuropsychological assessment. That then provides a great deal of information about what exactly is going on in your brain. How is your functioning altered? They're able to compare current functioning to past functioning because records are collected. There's a great deal of information collected about your education and your employment history and your social history, and so you look at all the change that's occurring and where the difficulties are showing up. Then, from the neuropsychological assessment, treatment recommendations are made. And oftentimes, it's recommended that people get cognitive rehabilitation, which is sitting with a cognitive therapist. Sometimes it's done in groups on a fairly regular basis, and addressing those cognitive skills like attention, concentration, focus, exercises that are going to help to maximize healing.
Okay.
And if not, you want to maximize healing, sometimes it's also about learning to compensate or work around the challenges. But people need help with that. So cognitive rehabilitation is oftentimes recommended. Individual psychotherapy also, to just get some help and some support understanding all these changes you've experienced, understanding them and then coming to grips with them, and then learning how to cope with them. So individual psychotherapy, group psychotherapy. Sometimes people will attend support groups like the one that Robin facilitates. And other treatment can include if people have sustained, vision treatment for their vision if they have visual problems. Sometimes people will get physical therapy, like Robin had the issues on the right side of her body.
I'm imagining medication might help as well, at least anxiety, depression.
In my case, no, because it was just sometimes the medication makes the symptoms worse. And, I think it's important for people to realize that a lot of doctors do just say, well, because they don't understand traumatic brain injury, well, you're depressed, here's an antidepressant. Your shoulder's bothering, you have terrible headaches, here's some painkillers. And then what was happening was you just become so foggy from all of the medications.
Yeah.
So I reached a point where I said, enough, I can't go that route. So I try to find the alternative therapies. And, psychotherapy, which is so incredibly helpful. And I see a craniosacral therapist that does myofascial release, which has been incredibly helpful. Yoga, just learning how to ground yourself, how to become centered and calm.
Now, how do you compare yoga to, let's say, walking a mile? What are the differences?
Well, certainly walking is a wonderful exercise. Anything that you can do to just get yourself away from whatever your situation is and just find some peace and comfort. If you're walking and you can just take in all the beauty around you, or you're practicing yoga and you can become very, grounded and centered with your breathing and
So
the
it's
postures.
the breathing that helps.
It's the breathing. It's just being grounded and centered and calm. And no matter how you find that, whether it's in a walk, whether it's sitting in your yard, taking a walk in the park, whatever it is, you have to kind of just get away from all of the things that are constantly draining you down. And it's been helpful. It's been extremely helpful.
Now, what about meditation? Is that
Again,
important?
same thing, just being able to go within and get centered and grounded and just concentrate on your breathing and let go of everything else that's around
But
you.
it doesn't necessarily mean music,
No, it just, maybe you could speak a little bit
just
more about
quiet, thoughtful.
Right.
Well,
And that's all you need.
there is a great deal of internal confusion. When you have cognitive difficulties, there's internal confusion, making sense of your world, and then the thoughts that follow around that. And then the thoughts will also move into, oh my God, how am I going to handle this? How am I going to get to the grocery store today and take care? How am I going to deal with my kids when they come home from school? How am I going to deal with my life tomorrow? What's it going to be like in 5 years? Where am I going to be? Am I ever going to be able to work again? So people get scared and they start having all these thoughts, racing through their minds as they face the the challenges. It may start with one small challenge. You forget where you put something in your house, and then a cascade of anxiety-ridden thoughts and fears can flow from that.
And distractions as well, right?
Absolutely.
So what meditation can offer, what yoga can offer, is learning how to get grounded, learning how to come back into the here and now, live in the present, take one breath at a time, one moment at a time. And when you break it down like that and somebody learns, because in our lifestyles, we don't live in that way. Our minds are ahead of our bodies we may be washing the dishes, but in our minds we're already thinking about what we have to do next. When you get a brain injury, you can't you can't manage it like that anymore. You have to slow down. And a practice like meditation or yoga helps you to learn how to do that and to find a sense of centeredness and peace eventually within yourself. And that can be found by learning how to come into the now. And for some people, they're so overwhelmed. Just taking one moment at a time, one breath at a time, one task at a time, one day at a time makes such a huge difference in the quality of life.
Well, then I would think someone would either have to get a different job or say that Christmas wasn't going to happen or holidays. And say that's the rule in the house.
Yeah, priorities change.
Yeah.
They do change. And, I often say that sometimes I've turned it around to look at it as being a gift, a blessing, because it did slow my life down a lot. So, it's taking in and noticing things that I didn't have time to notice before. So that, it can be a blessing in disguise. I mean, it didn't feel like that in the beginning, but I finally have reached that point in my life where I'm okay. I can deal with this, and I can help others now deal with it.
Now, I want to hear more about routines. How do you set a routine for your day, for your week? What is the process you go through?
Everything is written down, or, over the last 2 to 3 years, I have finally moved to an electronic device. I was very hesitant, but prior to that, everything is written down. And even using that telephone that has the planner in it, I still, around my house, have lists. I make lists of everything that I need to get done. But I don't make them so huge anymore and overwhelming.
That's what I'm wondering is, are they overwhelming? And are you overwhelmed by looking at the list?
There was a time I would have been, but I have learned coping skills, and I've learned what I need to do to make it manageable. So I choose the things that I feel I can do within the course of the day. And if I don't get to them, they just move to another day. But I don't beat myself up anymore if I can't get them done. Going to the grocery store is still to this day a huge challenge. So I make a list of the few items I need, and if I don't get everything that day, I'll go back another day. So it's just being comfortable and accepting that. That's the way it has to be. There's days I still get frustrated, but for the most part, I can get through the day now and be okay.
And how do you not get distracted or not allow yourself to multitask? How do you? What are your techniques?
I can't multitask. I cannot. So I find the one thing that I'm going to work on, I get distracted. I can be in the middle of something and be distracted, which can then be dangerous because I go off to whatever it is I'm distracted by, and I forget what I'm doing. So consequently, there's many times I'm burning something on the stove, or I'm putting the milk into the pantry, or, those things still happen by these distractions. And, I don't ridicule myself as much as I used to when that happens now. I just kind of laugh at it and say, I wasn't paying attention. So it takes a lot of effort. It takes a lot of work, and but it can happen. It can work out.
So what are your tips on self-care, sleep, diet,
definitely.
etc.?
And then you reach a point like I'm at right now with a lot of things going on in my life where that becomes a challenge. So consequently, I can feel myself kind of fading a bit and being overwhelmed. But for the most part, I try hard to, practice yoga every day, to get out and take a walk, to do the things that bring me joy, and get me centered and grounded again so I can continue to move forward. And it's not a perfect science. You know, there's days it just doesn't work out and I'm completely spent. So I
But
try
your
my
family
best.
must sense your signals and react
Well,
to that,
my
right?
husband, you know, who I've been with now for almost 43 years, he is very in tune to the signs, you know, and if we're at an event and he sees that I'm overwhelmed, he'll just take me by the arm and lead me out or tell me, and I need to just go to another space and, you know, chill out a little bit. He sees it. He picks up on it.
And hopefully the family members understand when they're like, well, where did you go? Why don't you join the party?
Not always. No, that's still the biggest challenge.
So that's another
That
thing
is
is
the biggest
the
challenge.
family dynamics that occur when TBI happens.
If you're lucky like I am.
How do you deal with it?
If you're lucky like I am, there's at least one person in your family that understands and gets it, as my husband does, thank goodness. But there are other family members that do not get it and to this day will not accept that there's anything wrong, and, you know, you just deal with it, you know.
And you can't feel bad about it, right? Can you talk more about that?
Family members have a difficult time understanding for a number of different reasons. The individual who's injured doesn't understand, usually for a period of time. Sometimes even the medical people, you know, the doctor doesn't really know what's going on. So the person who's injured can't say, you know, if you have a broken leg, your family knows by looking at you what your limitations are going to be, and everything adjusts around that. But Robin said earlier something like, you look fine, and people with TBI hear that a lot.
Oh,
you
yeah.
look fine, so everybody around you, including your family, expects you to behave in the way they're accustomed to you behaving. You look fine, but you're not fine. And you're not functioning, you can't function the way you used to. So the individual, it takes some time for the person who's injured to figure that out. As they figure that out, they begin to fill their family in more and more, plus their family is noticing, though maybe not always understanding and not always necessarily having empathy, because it's not clear what's going on. Right. So it takes time for the individual to get it, for the family to get it. And if somebody has changed really dramatically, it can be very difficult for a family. This is an injury that affects the person, but it affects the whole family.
Right.
And it can be really hard for the family to make peace with the change and to come into full acceptance of the change. And so oftentimes I'll hear from people, you know, that they have family members that just don't understand, and it becomes a source of tension or conflict within the family. In Robin's case, she has a wonderful husband who gets it and supports her.
It's been great.
Yeah. I wanted to say too earlier, Robin was sort of getting to this when she said, I don't beat myself up anymore. Coming to that place of acceptance takes some time. Most people, when they first start to recognize how they've changed because of the injury, they keep thinking about how they used to be, and that's where they want to get back to. Of course, who wouldn't want to get back to just the way they were, so life can be just the way it was. In some cases, for people with very mild injuries, maybe that's going to happen, but a lot of the time it doesn't happen. You don't get back your life exactly the way it was. And sometimes it's really pretty significantly changed, as we've been talking about. So it takes some time to learn how to accept that. That process of acceptance and coming away from measuring yourself always against how you used to be. I used to be able to do this. I used to be able to do that. Today I only did this.
Right.
Then you feel disappointed in yourself. Over time, you come into more and more acceptance. You stop measuring yourself by the old standards. You develop a new set of expectations for yourself. As Robin said, her lists are smaller. She's not going to make a to-do list as big as it would have been before she was injured. But she came into acceptance, and when people come into acceptance, that's when they can start to rebuild their lives and make good use of the different coping strategies that you can use at home, like yoga and meditation and good solid self-care, like being willing to pace your activities. That's a really big one.
Right.
Take breaks as needed, take rests, get adequate sleep at night. So you can rebuild once you've accepted. And if a family or members of the family can come to that place of acceptance with you, then they can rebuild with you. So they change along with you in terms of what their expectations are. That's really important.
Very interesting. Now, you have both mentioned support groups. Can you just, Robin, describe your support group and who do you help?
My support group is through the New York State Brain Injury Association. And I started it about 7 years ago. They had a general support group that I would attend, but I just didn't find it to be, I just felt there were issues that women wanted to talk amongst themselves about. So I started this group, and it's open to any woman who has had a brain injury or is affiliated with a woman that has a brain injury. And it meets every Monday and at Living Resources, which is a day treatment facility. And we just meet and talk about whatever topics they feel like talking about. But I get a lot of people calling me. They get my name off of the website, and I get people calling from all over the state, asking where they can go for help, if not attending my group, where there are other groups available. And it's been very successful. It really has been. It's just nice for people to know that they're not alone. There are other people that share the same issues and struggles. And from that, they grow and move forward, just knowing that they have that support and bond.
Okay, so there's a link to your support group off of the Brain Injury Association's website,
Right.
which I believe is Hygienist.org.
Yeah.
Do you want to give your contact telephone number?
Yep. I put out my phone number to people to call me, and I can direct them from there. It's area code 518-210-5049.
Okay, and then I have another phone number for Hygienist support groups, 459-7911.
Correct, yeah.
Is the Brain Injury Association.
Yeah.
Okay.
Yeah.
And do you want to just give some information on your practice, where are you located, and your telephone number?
Sure. So my practice is on Madison Avenue in Albany, and my phone number is 518-424-6097.
Okay. Thank you, ladies, for coming in.
Thank you, Peggy.
Thanks for watching. We hope to see you next time on Focus on Health.